Hello, my name is Dr. Mark Socinski. I'm the Executive Medical Director of the Advent Health Cancer Institute in Orlando, Florida. So the data behind low-dose CT screening for lung cancer really is built on the fact that CT as a screening tool is the most sensitive method to detect nodules. In that obviously we want to detect cancers when they're at a much earlier stage. We had data from a decade ago, the National Lung Screening Trial, that looked at low-dose CT scans in patients that were over the age of 55 and had at least a 30-pack year history of smoking. And there was a reduction in mortality of about a 20% risk reduction for those patients that were screened with low-dose CT scan versus those that were screened by plain chest X-ray. Remember, chest X-ray is a two-dimension test. CT scan is a three-dimensional test, more likely to pick up pulmonary nodules. And again, this lung cancer reduction was about 20%, lung cancer death reduction. And again, all-cause mortality was reduced by about 7%. So it's important to realize that. More recently, almost a decade later, we had very similar data from the Nelson trial. And the Nelson trial was looking at the role of, again, low-dose CT scans as a screening tool for lung cancer, and had a very similar outcome compared to the National Lung Screening Trial, with about a 26% reduction in males and actually a slightly higher risk reduction in females of about 39%. So this was actually even more convincing data about the role of CT screening in the detection of early stage lung cancer. Now, despite these two trials, we still have a relatively low rate of screening in the United States. I think the awareness of the lung cancer screening data in general probably is not where it needs to be in the primary care sector. We do know that if patients are made aware of the potential benefit of screening, that most patients, if recommended by their physician, would undergo screening for early detection of lung cancer. So, we need to think about strategies to improve the rate of CT screening. Obviously, it starts with education. It starts with education in partnerships with internal medicine and primary care and family practice. Make sure that that's part of their educational system. Public campaigns can be helpful. For instance, the American Cancer Society promotes lung cancer screening. We also have to really make sure that there are not other barriers. Are there reimbursement issues? Are there other things that we don't really know about? Is there advocacy for policymaking across insurance companies for making sure that these things are reimbursed, as we do know that they reduce the mortality from lung cancer to a significant degree. So I think that the data clearly supports it. It needs to be practiced more because we're under screening the patients at risk for lung cancer. And it really is pertinent to our primary care community to make sure that they hear this message and advocate for lung cancer screening in patients at risk.